Hello, everybody, and welcome to the Parkinson's Disease Education Podcast. Today, I have a special guest with me. I'm joined by Sarah Aud, founder of Silver Speech Innovations. Sarah has a master's of clinical science in speech-language pathology. She has nearly 20 years of experience in adult communication and neurological conditions, and now she's focusing on building innovative online tools that make speech and communication practice more accessible, including a Parkinson-specific voice and speech practice program called Get Loud, Stay Loud. This is the first of a six-part series that we're doing on communication changes in Parkinson's disease. Today's episode is entitled Communication Changes in Parkinson's, What's Happening and Why. As soon as we get back from the intro, we're going to be diving into that topic, and I think you're really going to like what we're talking about and learn a lot. So without further ado, let's roll the intro and go. Welcome to the Parkinson's Disease Education Show, where we demystify the disease and empower you as the person with Parkinson's disease to reach your true potential. The content contained on this show is for informational purposes only and is not meant to be a replacement for information or advice that you receive from your in-person medical or therapy professionals. If you haven't already, I hope you'll consider subscribing, and for an even more personalized experience, please ask us about our memberships. Now, without further ado, let's start the show. Okay, so Sarah, we're going to be talking about communication changes in Parkinson's, and this is a big topic. I think you would agree. All the topics are big, but this first episode is going to be jam-packed with a lot of information. Sorry, I meant to say welcome, and I'm really glad that you're here. I'm excited to talk about this with you, and I hope the audience really enjoys the information that we're going to be bringing to the table today.
Well, thank you for having me.
My pleasure. It's great to have you on. I want the audience to think of this kind of as essentially an overview of the different communication deficits that can be found in Parkinson's disease. I think a lot of people, if I were to poll the audience, I didn't, but if I were to poll the audience, I would guess that most people are familiar with some of the most common things, like maybe lower speech volume over time, gravelly voice. They might be familiar with cognitive impairments, but there's so much more to it than that, and it's so multifaceted. I think you would agree with that. But just to summarize for a moment, we have some key topics that we want to discuss and go into more detail on. And those topics include verbal communication changes, but also nonverbal communication changes. And we touched on cognitive communication changes. That's another thing that's important to discuss, as well as emotional and mood factors that affect communication. That might be a piece in addition to some of the other things we mentioned that may not be thought of commonly. So in your experience, would you agree with that?
Absolutely. I mean, the communication changes that can happen with Parkinson's, as you said, they can really vary. The number one issue, and I think most viewers would agree, but the number one issue that people tend to present with in Parkinson's is that low volume voice. So, my voice just doesn't have the power it used to have. Voice changes. I don't sound like myself. I used to have a really strong, robust sounding voice, and now people are constantly asking me to repeat myself. That's probably the number one issue, or the number one complaint as far as communication in Parkinson's. But as you mentioned, there are so many other things that can occur, and every person's a little bit different. And I think I heard one person explain it the best way, that if you've met one person with Parkinson's, you've met one person with Parkinson's. No two
Amen.
people present identically. So it's important to know the wide range of communication issues that can happen as Parkinson's progresses.
Absolutely. And the thing about it is, some of the things that Sarah mentioned are things that the person may notice about themselves, or that other people are noticing about themselves. But a lot of the things we're going to be talking about today that we touched on earlier are a little more subtle, and they may not be linked with Parkinson's at first. So what Sarah just mentioned was really reduced volume of speech. But in addition to reduced volume of speech, reduced intelligibility is important to recognize, because somebody may, I think Sarah already touched on this, but basically you may have you may not be able to speak as clearly or enunciate words as well.
Mhm.
And again, all the muscles in the body are affected by Parkinson's disease, which includes the speech system,
Yeah.
not just the limbs. So, in addition to that, you could have issues with basically the speed at which you or the rate at which you say words. Can you tell us a little bit about, in your experience, about some impairments you can find there?
hmm So, as you mentioned, Parkinson's, we don't often think about the muscles in the mouth and the throat being affected as, as the other muscles of arm swing and length of stride and all those things that move your body parts. But there are muscles, smaller muscles involved in the mouth and in the throat and even in our breathing, which affects how much we can fill our lungs and, get a good breath to project our voice. But as far as speaking clearly, the muscles of the mouth, they can become slower to initiate. They can be less coordinated. They can move smaller and smaller range. So, of course, your articulation muscles, the muscles that are involved in enunciating, can become affected. So, speech doesn't sound as clear. There's also issues or can be issues with the rate of your speech. So for some people, the rate of speech presents slower. So speech is actually slower and more laborious, where other people have the opposite problem with really fast, uncontrolled, cluttered speech, which is called
Mm-hmm.
festinating speech. And you know the word festinating from festinating gait, when someone
Yeah,
has that really fast, rapid, uncontrolled rate of walking.
right.
And the best way that I can think to summarize the issues that happen across the board, not just with communication, but with many of the other systems in the body, is that Parkinson's is the disease of low amplitude. It makes everything
Yep.
smaller in size. It makes everything smaller in frequency. So if you think about from a communication perspective, the size of your voice becomes smaller. The size
Yeah.
of your articulation becomes smaller. The size of your facial movements, so facial expression, becomes smaller. And when you really think about it from that perspective, it makes sense why all of those issues can happen because they're all tied to initiating movement, size of movement,
Mm-hmm.
frequency of movement. I mean, even eye blinks can become reduced in Parkinson's, which can result in those dry eyes that people complain about.
Mm-hmm.
So, low amplitude across the board.
Right. And I love that summary or that phrase of disease of low amplitude because it really does sum up so many different things that we see, particularly with motor functions in Parkinson's, um, including speech, of course. And I love the festinating gait tie-in because I think that's kind of like it might click for some people a little bit more to call
Hmm.
it that because I think most people are familiar with festinating gait and what that looks like.
Yeah.
Although, as a therapist, I can tell you there's some crossover between what people think of as festinating and what people think of as um, just the shuffle gait. There's a
Yeah.
difference.
Yeah.
The way I learned festinating, this is going on an aside, but the way I learned festinating in my doctoral program is that festinating is actually a loss of a fall that is happening in motion.
Mhm.
So when you're festinating, you're taking
Mhm.
small running steps to
Yeah.
prevent yourself from falling forward. You're
Yeah.
just moving your base in front of you continuously until you get to something where you can stop, like a
Yeah.
wall or a
Yeah.
piece of furniture. Whereas the short shuffling steps that can happen without falling or losing your
Mhm.
balance. So there is a difference. But yeah, when you're festinating, it's something you can't stop
Mhm.
because until you get to that stopping point, like I said. But in the speech, it's a similar thing because you might have somebody that is the words are coming out faster and faster, not controlled, and that's where you get kind of a little bit more into that cluttering kind of sound. If you're not familiar with that, it's basically I don't even know how to describe that honestly, but
It's just a very fast, cluttered, uncontrolled, almost frantic speech.
yeah,
And there's really no control over it, and it can be quite debilitating because it can kind of cycle. And there's people that can get quite repetitive as well in their festinating speech, And it's, I think a lot of factors can make it worse, like stress or fatigue.
Right.
But there are strategies that are available to help with festinating speech.
One other item on the list of verbal communication is the issue of word finding or basically word finding and sentence formation issues, or you know, it kind of ties in a little bit in some ways with that the tendency of individuals with Parkinson's to have a mild level of cognitive impairment,
Mhm.
where it's not that you forget the words or forget the person's name or
Mhm.
whatever, but you pulling those memories forward is impaired. So those memories are there, but pulling them forward is impaired. So it can make a person with Parkinson's appear slow in terms of cognition or thought processes, but really they're
Yeah.
just trying to remember what they're trying to say, right?
Yeah. It's like the words that you're trying to get are lost in a big clutter of words, and you know what you want to say, but just pulling them out as quickly and as fluently as you used to can be a challenge. And I really think I think it's important to know that it's not the same sort of mechanism or situation as someone that's had a stroke, where they've
Right.
had the actual that that
Speech
left-sided
centers are damaged.
area of their brain that's been affected.
Yeah.
It's more just due to that general cognitive slowing that occurs with Parkinson's, and
Hmm.
cognition underlies everything that we do. Really
Yeah.
without that really firm base of strong cognition, there's not much that we can do. So with some general cognitive slowing, it makes sense that your word retrieval or your linguistic ability is going to be slower as well. And I think that's what's the main issue when people complain about not being able to find the words like they used to.
Right. Well, for anybody that any individuals living with Parkinson's that are watching or listening to this later, and also caregivers, care partners, spouses, whoever else is listening to this, loved ones. As the person with Parkinson's, I want you to give yourself some compassion here, because this is not your fault, and it's something that you have to understand about yourself. But also, those of you who live with someone with Parkinson's, or if you're listening to this and you have a friend or another family member, have compassion on them, because it's similarly to somebody that has a more severe form of dementia, where um, you may have somebody that has a problem with processing verbal information. So this is the opposite. But what I'm saying is, you may have somebody, if somebody has more severe dementia, it's sometimes you could say something like, "Joe, I need you to get up from the chair," and they heard you say that,
Mhm.
but they may not react to what you said for several moments. It could be 30 seconds, 60 seconds. It could even be 2 minutes later,
Yeah.
but they will react to what you said. But it literally took that long to process what you said. So similarly, when you're trying to say something and you're having difficulty finding those words, particularly if you're not the person with Parkinson's, give them some grace to come up with those words and tell the story, because it's there. It just may take a little bit longer. So it may take a little bit of patience just to get through whatever is trying to be communicated. And again, have patience with yourself, because you're not losing it. It's still there. You just have
Yeah.
to find those words.
Absolutely. Yeah. The words don't quite come out as easily as they did. One thing that caregivers can do that can be helpful is if the information isn't coming out the way it's supposed to, they can also just confirm what they did understand. Oh, I understand, Joe, that you want something. Okay, I know you want something. What is it that you want? So confirm the information that they did receive, that they did, that did come through
Yeah.
successfully, and then just focus on the next maybe smaller piece of information that the person's trying to convey.
Right. It's easy to finish sentences too, which is not in and of itself bad, but it could really get on someone's nerves if you're
Yeah.
they're trying to
Yeah.
talk and you're always finishing the sentence for them. But I guess what Sarah's saying too, in that sense, there could be a more graceful way to do it. Would be to say, like, I think what you're trying to tell me is,
Hmm.
um, I think what you're trying to ask me for is the car keys or whatever it is.
Yeah.
And then that person will be like, "Oh yeah, thank you. That's what I was trying to say."
And for people that have been together for years and years, there are couples and spouses that have been together for years, having those open conversations about what do you find helpful when you can't find the words,
Yeah.
or when you're not being understood. Is it okay if I do that, or would you prefer that I do this? I think being as open and honest and having those conversations will go a long way to reducing those frustrating moments in the long term.
Yeah. I
And
mean, what we're talking,
person with Parkinson's that I worked with previously, they had a great saying for the quiet voice, because I know that lots of people have this quiet voice. They can't be heard. They can't be understood, if it's you're too far apart from the person. They had a rule of no floors or doors, meaning don't try to speak to a person if there's a door or a floor between you. So don't try to yell upstairs to the person.
yeah,
Don't try to yell it to them in the next room. Make sure that you are in the same room, that you are within, hearing distance. And that can go a long way to reduce frustration between
yeah,
individuals with Parkinson's and their loved ones and caregivers.
that's a fantastic bit of advice on that, actually. And that could go for a lot of us, actually. Um,
Actually, my husband and I started that rule because it drives him insane when I try to yell something up to him and he's like, I've got the vacuum on, I can't hear you. So, yeah, not
have you
just for
ever
people
heard?
with Parkinson's, it's just general good advice for anybody.
Exactly. Well, have you ever heard there's a, I think there's a, I don't know if it was a T-shirt or if it was a meme, but it said, marriage is being in another room and the other person yelling, "What? What?"
I think we can both relate to that.
For sure, especially if you throw kids in there.
Yes,
Um,
absolutely.
then the kids are the ones going, "What?"
Yeah.
Um, so when you have a speech disorder, it definitely gets in the way sometimes. It adds to that factor. And what I was going to mention before we move to the next topic on our list is um, some of these things, including what we've just talked about. If it's not thought in your the forethought of your mind to some of those techniques we were talking about communicating about the issue, finding ways to work through it, understanding it, acknowledging it
Mhm.
to begin with, it can
Yeah.
build a lot of resentment, especially between um, spouses, where one spouse is taking on this role a little bit more of a caregiver versus just a spouse, a loved one. So there's other topics within what we're going to talk about that could definitely result in that resentment building up if
Yeah.
you're not aware of it or
Yeah.
not prepared for it.
And I think
Um,
that's an important point that, and you mentioned before that the caregivers need, as much support as the individual with
yeah,
Parkinson's, and that they have to make sure that they are receiving the education and the guidance and the support that they need so that they can properly support their loved one with Parkinson's.
absolutely, 100%. Yeah, yeah, and that's what we're doing this for, um,
Mhm.
to help all of you involved with this, because it takes a village.
It does.
So we talked. What we've really been discussing for this first part is verbal. So let's talk a little bit more about nonverbal communication changes, and how that can present in Parkinson's disease. It may be more subtle than you think. I think most people think of the facial masking as one of the things that comes to the top of mind. But what else would you say could be included in that?
So, not just the reduced range of facial expression, but reduced body language, gestures, anything that we do with our bodies to convey communication. And it's
Hmm.
important to recognize the significance of nonverbal communication. Um, there are studies out there that say that our communication is in fact only about 20% verbal. The
Mm.
rest is nonverbal. The how we're holding our body, how we're holding our face, the facial expressions that we're making, the gestures that we're doing, even the sort of underlying tone behind our words. All of these things can play into how we're communicating a message to someone else. And
Hmm.
when we come back to that disease of low amplitude, our facial expression, of course, we can get that hallmark of Parkinson's, which is the masked facial expression, or called
Hmm.
hypomimia is the medical term for it. but
Hmm.
there can also just be less gestures, less body movement. And when that happens, the danger of that occurring is that the communication partner, the person listening, can start to feel that the person with Parkinson's is not really interested in the conversation because they're not showing that they're interested on their face. They're not holding their body as if they're interested. They're not leaning
Right.
in. They're not gesturing. So this can really result in a communication breakdown where this is the person with Parkinson's showing less nonverbal communication. This is the communication partner. They withdraw. The person with Parkinson's senses the withdraw. They withdraw because now they feel insecure. And
Mm.
this is where, in my mind, a travesty occurs where the person with Parkinson's no longer feels comfortable in, communicating with other people or in social situations.
Yeah. Yeah.
And we all know that when we are withdrawn from social settings and we don't have that communication interaction, that's when social isolation can set in. That's when depression and anxiety can worsen. So it really is something that is that should be addressed directly, so that that breakdown of communication doesn't occur.
Yeah. That's so important to recognize, um, because I really have a lot of I said compassion earlier, but I do have a lot of, I guess, sympathy is the best word, um, for people that are, and they may be completely changed from when they before they had Parkinson's in such a way that they were very social,
Yeah.
and they had that withdrawal, but just it's it's I'm sympathetic to having somebody that they feel emotions, they want to express those emotions, they may be truly listening to the person that they're engaging with,
Yeah.
but through no fault of their own, it's extremely difficult to show that reciprocation,
Yeah.
and then they're being perceived as rude um, or
Disinterested. Yeah.
disinterested, disengaged,
Yeah.
because yeah, I mean, if you got slumped posture and masked face, you might be sitting there going,
Yeah.
you know, and
Yeah.
they're listening, but it doesn't look like they're
And
listening,
they
or
and they could be
you know,
super fascinated by the conversation. This could be the most, exciting conversation they've had all month, but it's not showing.
yeah,
So, I think encouraging people who are experiencing significant changes to their nonverbal, their gestures, their facial
yeah,
expression, is try to verbalize. That's really
yeah,
fascinating. I'm really interested. I really want to hear more. The more you can be forthcoming with saying how engaged you are in the conversation and having those open conversations if you
yeah,
feel comfortable with the fact that maybe you're not displaying emotion on your face. That's just part of the Parkinson's gift. But
yeah.
certainly verbalizing, your interest in the conversation can go a long way to not having those communication breakdowns.
I was just about to say right before you said that, the first thing I thought of was those of you engaged in the other side of the conversation, listen very carefully, because you will hear the emotion and you will hear the interest come out of their mouth, right?
Yeah. Yeah.
Hopefully. So,
Yeah.
because I can tell you from doing this for 14 years, almost 14 years, that, um, and working with the Parkinson's population almost exclusively during that time, you I've worked with some individuals that are extremely stone faced, like
Yeah.
almost no emotional expression on their face whatsoever. But there you'll see, and again, some of this is nonverbal, some of this is verbal, but like you'll see a twinkle in their eye that you didn't see before you told them something funny, or
Yeah.
maybe their lip starts to curl up a little bit into a smile, um, or they laugh, but it could even just be, or they could reciprocate something, like if you're saying something funny or maybe you're teasing them, if they tease you back, you know that
Yeah.
they're engaged.
Yeah.
So it does become a little bit more of an observation exercise of
Mhm.
really listening to the responses more than watching, which is that's hard for us. As you mentioned, 20% is really verbal
Mhm.
overall, so we're not used to watching out for the other, um, we're not used to watching out for only the 20%.
That's
But it
right.
becomes extremely important when you're dealing with this. So just to say that. Okay, so we've talked a lot about communication, verbal and nonverbal. One thing that I think, as I said in the beginning, most people are familiar with some cognitive changes. I think it's important to understand briefly some of the, I guess, biochemistry involved a little bit, because with dopamine loss due to the dopaminergic pathways being damaged in Parkinson's disease, you also have other neurotransmitters as a domino effect that are affected by this. So I apologize for my clearing throat. I'm getting over a cold. The and Sarah's probably the whole time been listening to me clearing my throat, going, "That's not good for your vocal folds.
Oh,
Don't do
bad,
that."
bad vocal hygiene, Michael. No, it's okay.
I should have done some honey and tea. The dopamine loss also affects neurotransmitters like acetylcholine and serotonin. These are not the only ones, but those are two important ones. And we're going to go into serotonin a little bit and some of those changes. But the acetylcholine changes are what will affect your cognitive issues in the beginning, especially when you have the memory, the word finding issues, issues of, um, you know, it could be multitasking, executive function type of things where you're having to remember the processes involved in something like meal preparation or planning a trip out of town, and coordinating all those things in your mind. And also, we have written down on our notes planning what to say, because speech also involves executive function and planning,
Yeah.
and your filter of, should I say this or should I not say this?
Is it
Um,
appropriate for the
yeah,
setting?
is it
Yeah. Hmm.
appropriate? So slowed thinking, attention and focus. So attention and memory particularly are governed by that acetylcholine cholinergic pathway. And along with that, you can have slowed thinking processes, like I said, executive function issues, and the filter issues. So anything more you would add to that in terms of awareness?
No, I think it's you said it perfectly that when those things start to decline, which results in that cognitive decline, well, cognition underlies language. So word retrieval, planning, those higher level executive function tasks that are so important in how we organize what we're about to say. We don't realize, it's one thing to be on automatic pilot and just kind of respond to how are you? I'm fine. Those are automatic responses. But when you're in a novel situation where you haven't had that conversation before, you're in a higher level conversation, there is a lot of cognition involved in our everyday interactions. And of course
For
those are
certain.
going to be affected if our general cognition has declined.
Yeah. And it's important to remember, I think, too, that somebody that didn't used to be might become somebody who at times is a little bit more, maybe they seem more irritable, or they're short in their responses, and they may immediately or maybe a little bit later apologize for it because they didn't really mean to be short or blunt or respond a certain way. But again, it's that processing involved in planning or pre-planning,
Yeah.
um, because pre-planning is a frontal lobe function
Hmm.
in speech. So we have that prefrontal cortex in our brain that is specifically for those purposes of pre-planning, whether it's motor, like movement,
Yeah.
or future actions, or future words, or whatnot, and that's impaired, or at least those connections are impaired. So it's important to have that in mind as well.
Yeah.
Finally, this is the last bullet point, really, but it really kind of ties into everything we've already mentioned some of this a little bit. But emotional and mood factors affecting communication, because, as I mentioned a minute ago, acetylcholine affects the attention and memory, but our serotonin, antidepressants help you keep your serotonin levels higher, if that gives you a
Yeah.
hint. So,
Yeah.
or at least most of them, most of their mechanisms do that. SSRIs in particular. So, serotonin levels dropping will affect your mood, and that includes the most common symptoms with Parkinson's, that are depression and anxiety.
Mhm.
But you can also have apathy, which is basically a lack of desire or reduced drive to do things, um, and then reduced confidence in social situations, which Sarah actually previously mentioned. So let's go into that a little bit before we conclude this episode, um, and what that
Yeah, I was just
entails.
going to mention that the dopamine. Everyone knows that dopamine is the neurotransmitter that's largely affected in Parkinson's. But I think you're so
Yes.
right to bring up those other ones that can be subsequently affected, because when we think about serotonin and we think about dopamine, what comes to mind for me is those are your motivational get up and go neurotransmitters. Those are the ones
Yeah.
that keep you inspired and motivated to do all the things you need to do to live a good life, and to do all
Hmm.
your healthy eating, working out, doing your exercises. And when those are declining, well, then the person with Parkinson's is already behind the eight ball as far as
Yeah.
having the capacity to self motivate and
Yeah.
have being in the right frame of mind to do all the things that they know they need to do. They know they need to exercise. They know they need to do, speech and voice exercises, eating well, getting good rest, drinking enough water, all of those things. But when your frame of mind is such that you're prone to more depression and anxiety and apathy and anhedonia, that
Hmm.
just doubles the workload of getting to do those things. And so I think that's something really important to underline, is that they're not lazy. They're
Yeah.
not they're not stupid. They know what they have to do. They realize what they have to do, but they're literally pulling a pile of bricks uphill trying to get the motivation to do those things. So I think whatever we can put into place, whatever resources or education or support we can put into place to help overcome that, or to put things
Yeah.
into place that are easier for them to manage, goes a long way with having success in doing all of those positive things.
Yeah. And the apathy in particular, that well, and again, dopamine is a drug of desire in our brain. So you have lack of dopamine, you're going to have a lack of desire, and that could be for things you actually used to love.
Yep. Yep.
So even things that used to really give you joy, you may not really seek after them because of the lack of dopamine. And so the apathy, as that sets in, and it doesn't always happen early in the diagnosis, it could be
Hmm.
years and years down the road. But at some point, if that does occur, it has to be an awareness of the fact that, especially for the other person that's living with you, or a loved one that's with you, of recognizing, as Sarah said, that's not laziness, it's not a lack of knowledge of what to do,
Yeah.
um, but also something we're not even addressing in this series is the other non-motor and motor symptoms that can also make it an uphill battle to do anything.
Yeah.
So if you have apathy on top of generally feeling like crap, it's really extremely difficult to do what you know you need to do,
Yeah.
because fatigue and physical pain in some cases,
Mhm.
um, from different, there's various causes of that in Parkinson's, but there's just all kinds of barriers. And so, not that they can't be dealt with, but it takes a village, as we said.
Yeah.
So this has to be an area of, as hard as it is to it's easy for me to say, but it's true. It has to be from coming from a place of compassion to really be aware of these things to help your loved one with Parkinson's disease. Help them help themselves. I
Yeah.
had this question come up on the channel in the last 2 weeks, where somebody said that their dad has Parkinson's disease, I believe in the early 80s of age, and um, knows what to do, but just sits and watches TV all day.
Hmm.
And what can I do to help him? And which I love that they asked the question of what can I do to help him, because they know, they clearly said my dad knows to exercise. Is exactly what we're talking about in this episode.
Yeah.
And I actually wanted to cover apathy as a standalone topic in the future, on the channel. But point being, we're going to be getting into this in future episodes, so I don't want to give anything away. But just briefly, going to touch on this this topic of habit stacking is something that is super important that we're going to talk about later. So that's something that will become important, even more important. It's important for everybody if you're trying to develop consistent good habits, but it's paramount when you're dealing with a situation like this. So I don't want to give anything else away about that. Anything else you would add before we go into
just that probably the best way to sum up that apathy, one client described it as, it's like my get up and go got up and left. Like that feeling of wanting to do something, knowing you need to do it, but just can't organize yourself to do it.
Well, that's going to conclude the first episode. I hope you've enjoyed this. If you've been recognizing yourself or your loved one with Parkinson's in any of this conversation, you're probably wondering what you can actually do about any of this. And again, I kind of mentioned we're going to talk about more in the future episodes, but in the next episode, I wanted to let you know we're going to be breaking down the exact therapy approaches and core exercises that are designed specifically for Parkinson's disease. And you're not going to want to miss this. So come back next time, and we're going to teach you about that and a lot more in the future. Well, Sarah, thanks for being here for this first episode, and I had fun. I hope you did.
I did. I look forward to the next one.
Yeah, and we look forward to seeing you in the next episode as well. Be empowered and have a great day.